healers need healing. And so I would say the beginning of it is understanding that we have this calling to be healers, but at the same time, we need to be healed ourselves. And so in order to be healed, we need to open ourselves up and accept that as a possibility for ourselves. So I would just encourage folks, filling your cup, doing the things that fill you up is not selfish. It's actually the best thing that you can do for yourself and everyone else. Because if you're pouring out, there's nothing else to give, then you don't have anything else to give. But if you're making sure that you're filling up, making sure you're taking care of yourself, putting your oxygen mask on first, as they say, and then helping others, I feel like that's how we will see transformation in kind of the workplace environment.
Hello, welcome back to another episode of Welcome to Show, a show where we inspire the masses to become financially free while building God's kingdom. On the show today, we have Dr. Clarence Lee. Dr. Clarence Lee is a physician, entrepreneur, international speaker, executive coach, and the president and the CEO of Exhort Health. Dr. Lee is also a decorated veteran and holds a degree in biomedicine and business, and is a published author and regularly aired on TV health as a TV health expert. In this episode, we discuss Dr. Lee's journey as an entrepreneur and how he helps doctors break free from the rat race. So thank you for being here, Dr. Lee.
Appreciate you having me on. Excited about adding value to your listeners.
That's great. So my first question to start is, how are you doing?
I'm doing well. I'm doing well, brother. How are you?
I'm doing well. My first question to start this conversation is, what inspired you to become a physician entrepreneur?
Oh man, so many things. But I'd probably say that the fastest answer to that is our current healthcare system. I feel like it lacks physician leadership and physician equity in many of the organizations that are practicing medicine or administrating healthcare. So what really inspired me was just, a passion to want to impact my industry. But so that would say in the healthcare space, that's why. And then just in general with my books and speaking and coaching that I do, it was really just this passion to use my gifts to enhance the world and creating businesses while I was doing that.
Oh, that's good. So what made you realize that, at this point as you're in your doctor career that you can start, venture out and become an entrepreneur? Because oftentimes, doctors, they do their 4-year medical school residency and that's basically stake to that career and never go outside of that.
Yeah, I really just decided I didn't want to be a player in the industry. I really wanted to disrupt it. So, and during the pandemic, I found myself experiencing burnout, and I almost left medicine because of how it was being run. And so instead of leaving and picking another career, because I always tell people, I'm smart. I could learn to do pretty much anything. If I made it through medical school, I could go to law school. I could go to wherever school, So instead of kind of leaving and starting a whole new kind of career, I said, hey, well, I'm going to buckle down and double down on myself and see what a healthcare organization that's led by a physician could do in healthcare.
That's pretty impressive. I want to kind of use to elaborate on the burnout. How often is it for doctors to burn out in the medical field or just in general? How often is that?
It's extremely common. If you look at some of the recent kind of statistics, more than half of the physicians, practicing physicians, will report that they experience symptoms of burnout, and that's kind of on the lower end. It's probably higher than that. So burnout is very, very common, and there's a lot of reasons for that. But I would speculate the majority of the reasons are because we have corporations that are running medicine, and the physicians are kind of put into a staff role, and their main kind of productivity or incentive is really around billing and generating revenue. So the organizations that run or that employ the doctors will typically have patient quotas for them. And so the more patients they see, the more incentives that they get, the more that they make, things like that. And so that leads to high patient censuses. So high patient load, lots of patient volume, lots of requirements, administrative requirements around seeing the patient. So it's not just seeing the patient, but then I got to document and do all these administrative tasks as well. So I think the kind of the primary reasons are just the ownership models and who is actually making the decisions. So if you look at the CEO, the senior leaders of hospitals, the majority of the leaders on hospital boards, the majority of the CEOs of hospitals are not doctors.
Yeah.
They're business people.
Hey family, I hope you're enjoying this episode so far. And if you are and you have yet to subscribe to us here on YouTube, please hit the subscribe button. And also, if you're listening to us on Apple Podcasts and you have yet to leave us a 5-star review, please do so. Now back to the episode.
And then, what I'm thinking right now as you're speaking, I've is something what's it called, mixed diagnosis. I'm thinking like how it like is mixed. Do you think mixed diagnosis of patients correlate with doctors being burned out on a regular? Being the fact that there's a quota of seeing how many patients. Do you think that will they correlate to one another?
Yeah, I can't quote any current studies that I know of off the top of my head, but I'm more than positive. I mean, it's kind of hard not to. So
Yeah,
if if you are fatigued, if you are pressed for time, your ability to do your job in its most kind of thorough fashion is going to be affected. So I would definitely speculate that there's going to be more increased errors, medical errors, things missed, because you just don't have as much time. And if we change I believe if we change how the dollars flow, if we change how we are getting reimbursed, how we're actually getting paid, we can get rid of the fee for service model, and that is, that's what I started Exhort Health to do.
okay. So I guess I want to go more into detail, like why you started Exhort Health and the business model that you said should be switched around.
Yeah, so for me, as I was looking at, hey, what I thought was what needed to change in healthcare, the fee for service was one of the main things, and I said, well, why is it fee for service? And part of the reason is because the provider and the payer are different, meaning the person that actually pays for the care is not the person that provides the care. So the provider, the way that it's set up now, the provider, the doctor's office, the physical therapy department, the provider of the care will bill a separate entity. So I'm going to bill the insurance company,
Yeah.
right? The insurance company. And so the only way for the practice to increase revenue in the majority of models, there's some HMO models that are a little different than this, but the majority of them is you have to bill more. You have to bill more, see more patients, bill more, or do more services. So you get paid more for the more you do, which is kind of counter to highlighting quality and outcomes of your care. So instead
Mm-hmm.
of reimbursement being based on your outcomes, how well you can take care of the patient, how healthy you keep the patient, how, it's on the more you do. So many people call our current system sick care because the patient engages the healthcare system when
Yeah.
they're sick, when they have a need. So Exhort Health, my goal with Exhort Health is to really kind of separate ourselves entirely from that model and have the provider actually become the insurance. So 20 years down and down the line, Exhort Health will be an insurance. So Exhort Health will be offered as a benefit our members will pay for their health insurance to be a member of Exhort Health, and all of their healthcare needs will be taken care of. So it will be on the organization, so on Exhort Health, to make sure that we're keeping costs down, to make sure that, hey, we are doing the most with the dollars that are coming in, right? And keeping the cost of the healthcare down. So if I own the MRI machine, if Exhort Health owns the MRI, if Exhort Health owns the surgical center, if Exhort Health owns the hospital, then it's in the business's best interest to keep the costs low. So you're going to want to drive price down. And there's a few models that are out there. Intermountain Health is a model that I like. Kaiser is pretty close. And some of the HMO, where you have a hospital system that partners with an insurance, some of the HMOs are trying to tap into that to move away from the fee for service model. But I really think, am I creating an entire system? The dollars flow into the healthcare system. So instead of the dollars going to an insurance company, where an insurance company is going to carve off administrative fees, they're going to carve off their executive compensation, and then they're going to pay claims with the rest of the money. Okay. So instead of having an insurance company as a middleman, have all those dollars flow directly to the provider of care, so that the person is paying their healthcare insurance, if you will, but those dollars are going to support the very people that are providing the care. Mm-hmm.
That makes a lot of sense. Basically, you cut out the middleman. And, I just want to ask you if you can elaborate what HMO is for those who maybe listen, may not know, who may not be familiar with that term is.
Yeah, so HMOs are really systems where an organization is like a health management organization, if you will. And so an HMO is where, say, an insurance company will pay the HMO, which are the providers of the care, they will pay them, say, $600 a month per member. And however many members are impaneled to that HMO, that's the revenue that the HMO receives. So, okay, we're going to impanel 500 patients to you. For those 500 patients, you're going to get $500 a month, but you're not getting any more. So if they go to the hospital, if they have a heart attack, if they, they break their leg, you have to make it work with the per capita fees. And so that's the kind of the HMO model where, it's really behooves the HMO, the providers, to make sure the patients are taking their meds, make sure the patient is healthy, make sure they're providing kind of services to keep their members healthy. Because the more they utilize the care, that's kind of the more the HMO will burn up their capita fees. My office has the lights. I'm not moving. So that's it. Versus that, so an HMO will have kind of a main system that you can go to. They try to control cost, versus a PPO, which is kind of a preferred provider organization, where you will have access to lots of different providers in a PPO. Where HMO is usually you will sign up with one main group, and they will kind of direct your care. Whereas PPO is more of kind of like open access. You'll have more of ability to go to different places and choose where you're seen.
That's pretty good. And I want to kind of ask, because you mentioned that what led you to create your company is burnout. And I know that there's a shortage of doctors in the economy, in this current economy. Do you think like an increase of doctors in the current economy, as well as, following this new model where you cut out the insurance, where doctors are getting the fees, and, it's the way they're getting better compensated. As a result, they were able to take care of the patients. You think that will help increasing the amount of doctors that are in the economy?
Absolutely. I think we need to be able to produce more doctors, and the learning curve to create a doctor is decades. Okay. So we're talking undergrad, medical school, residency, fellowship. And so the pipeline to create docs is really limiting us, which is why you will see a proliferation of ancillary providers like nurse practitioners, physician assistants, because we can't produce enough doctors fast enough. So there's if you look out, there's definitely going to continue to be a shortage because there's just not enough medical schools to produce the doctors. So I do think that if we were able to produce more docs, that would help. But I think more importantly, we need to change the ownership models of the practices. So instead of a practice being owned by a nonprofit or a private equity firm, actually let the doctors be the equity owners. Because if you remove the rubber on the road, or the providers that are first contact with the patients, if you remove them from leadership, then it leads to this Six Sigma efficiency kind of mindsets going into healthcare, which doesn't really equate to better outcomes. It actually equates to worse outcomes. But when the entire reason for the corporation or the private equity is to make money, where you're going to look at how you can generate more revenue, opposed to if the entire intention of the organization is to help its members be as healthy as possible. Well, now your mindset and your thought process of the business is around providing value that's going to get the patient better outcomes, right? So you're really looking at how to get the patient better outcomes, how to keep them healthier, how to incentivize them to make healthy choices in life, opposed to thinking, how can I bill more? How can I get more patients? How can I see more patients?
That's very powerful because what I'm thinking right now as an African American, I know as an African American community, a lot of people don't want to go to the doctors because they understand that as a business where you basically get billed for everything. It's basically they're not really trying to make you feel better or get better in terms of being healthy, just to keep having you come back and he keep prescribing different medication, take different tests. Which kind of leads me to ask, what are some challenges, with you trying to disrupt this new the industry? Like, what are some challenges you are facing, trying to disrupt this industry?
Man, lots of challenges. I'd probably say at the top of the list is many times patients, they think they have adequate health insurance. They show up and say, "Oh, I have health insurance," but they have no understanding of the product that they have purchased from the health insurance company. So they say they choose Anthem, Blue Cross, Aetna, whichever one. They don't have a true understanding of the policies, the agreement that comes along with that. So many patients will have high deductibles, meaning they will be paying their monthly premium, but the product that they purchase from the insurance, the agreement says that you have to spend $15,000 before the insurance will pick up any bill. Many patients don't understand that. That's a deductible. Many patients don't understand what a copay is versus co-insurance. You got your copay, you come in every time you utilize it, depending on what services you do. You go to a specialist, you go to a primary care, you go to PT, you go to chiro. There's a copay, but that copay changes depending on the incentives. And then there's this other thing called co-insurance, right? So then you got co-insurance. But what is co-insurance? Well, after you get the bill and the total amount, depending on where you go to, now you're responsible for a portion of that, depending on what your co-insurance percentage is. So the biggest challenge that I've seen is, one, patients showing up not understanding their services, not understanding their insurance plan. They think they just show up with the insurance card and, oh, my insurance is going to take care of it, where the majority, I'd probably say half of the bills that we will see will turn out to be patient responsibility, meaning the patient will be responsible for the actual bill. And so that's when you get people say, "Oh, I got surprise bill. I got this bill 2 months later. I got this bill for $600. I went to urgent care," because they don't understand their policy. So that's one. Patients, that's one of the challenges, educating the patient on what your actually insurance is doing for you. Two is actually collecting from the insurance companies. Wow. So many times insurance companies like to play these games. "Oh, you didn't have enough documentation. Oh, I didn't get this. Oh, you didn't put You didn't put the Z at the end of the member ID number. We got to push it back. And then they'll sign agreements with provider groups. And they'll say, oh, you want to be in network with us. And they will just negotiate discounts. So they will reimburse less and less for the services, and then, take 2 months to pay you for your visit. So that's another challenge is in the traditional model, the medical practices have just assumed the burden of collecting from the insurance.
Yeah.
It's just how we do business. We have a billing department, right? We have revenue cycle management. We have a collections department. The medical practices have just assumed that burden. But at Exhort Health, I say, well, that's how business is done usual. Well, we're not doing it that way. I'm not going to assume the burden to collect from Anthem Blue Cross. Anthem is not my insurance. It's the patient's insurance. So I want to empower the patients to engage with the insurance companies. And so if they come in, if services are rendered, they pay up front for the services. And I say, hey, deal with your insurance to get your reimbursement, deal with your insurance, the insurance that you chose, that you picked with the product that you bought. And you talk to them about how they're supposed to be paying your medical bills. You see, and that's different. And so I think by applying pressure to the insurances and actually empowering the patients to understand the products that they're buying, we can get insurances to do a little bit more for the patient. I always ask patients that have health insurance, I say, oh, health insurance, I take care of your health needs. What's your health insurance do for you this month? What they do for you? Oh, did you go to the urgent care? You hurt yourself? Oh, did anybody from your health insurance call you and see how you was doing? Oh, they didn't, but you're paying them every month. But your doctor, the doctor that you see is checking up on you. They seeing how you're doing. We're sewing up the laceration, So I love my health insurance people, but I do think that the model, if they do not up their game as far as taking care of the patients and making it easier for doctors to use, it's easier for the patient to use insurance until they make it easier for the patient to use insurance versus cash. Because I'm a business owner and I would take a cash patient over an insurance patient all day long. Wow. Because if I take the insurance patient, I got to spend money to try to get that money now.
That's true.
The patient show up with cash, I got to spend no money. It's exchanged right there. It's done. But actually taking insurance, doing it the normal way that medicine is done, the doctor's office actually has to spend money to collect.
Oh.
What's up, fam? If you would like to cop some fire Wealth in Christ merch, you can go to wealthinchristbrand.com. We have t-shirts, hoodies, sweatshirts, all available on wealthinchristbrand.com. Thank you guys for your support.
Wow. Just like this talking to you in this conversation, I see two issues that you brought up. One is the patient in terms of them being educated in terms of the insurance that they have. And the second issue, is going back to doctors in regards to how they can, take that ownership, take that, be the front line of the business. My question is, how can doctors become more equipped in terms of being a business owners? Because oftentimes, as an entrepreneur, know that not everyone is equipped to run a successful business. So how can we equip doctors to become that successful business owner?
Yeah, I think the most important thing is getting a mentor, someone that is out ahead of you that can help you to see some of the barriers and the blocks that you're going to come up against. So that's number one. And I actually help doctors do this very thing. And as I act as a mentor through coaching programs to coach doctors that are entrepreneurial to help them understand that, hey, there's other ways for you to actually generate revenue as a physician other than seeing more patients and doing more procedures. So I help them to see how are these other ways to generate revenue and help them to kind of practice medicine on their terms. But I think the big thing is finding a mentor, someone that's ahead of you that can kind of show you the ropes and kind of give you some guidance. And then, being a Christian, I think the most important thing is to, seek guidance from God. And so, I got this this message from God. Hey, I want you to leave your job. I want you to start Exhort Health. And Exhort is actually short for exhortation, which is a spiritual gift in Christianity of encouragement. And so I'll get all this downloading to do all these things, but many times in entrepreneurship, I think the biggest fear is the fear of the unknown, and many people kind of shy away from that. But this is probably the most heavy faith lifting or faith building process I've ever been through is entrepreneurship and building a business, and not having a normal paycheck every 2 weeks that I know is coming, but also having, but now having to go out there and generate that, right? So I think entrepreneurship is definitely not for the faint of heart. It's a hustle. It's a grind. But I do believe, by putting your feet behind your faith, and walking out and having that certainty, God is going to bless that, and He'll be there with you along the way. Not to say it's going to be easy. Not to say you're not going to have down years. Not to say that you're not going to lose money. But I do believe that, our gifts will make room for us. If you have a gift or a talent, I do believe that, God gave you that gift or talent to use in the marketplace. And so I think we need to have Christian business owners in the marketplace taking territory for Christ in the business world. So our ministries don't necessarily just have to be in the pulpit or at the church. I am ministering out in the community by doing business with Christian morals, right? So, yeah, I think for more doctors, it's going to definitely be a leap of faith. It's hard, it's tough, but somebody's got to, and this is what I told myself, somebody's got to be willing to take those blows to affect the change. And I feel like there's a wave, there's a ripple that's happening in healthcare. And I think it's leaning toward physician ownership.
Wow. It's kind of funny. You kind of answered my next question, was basically, how has your faith kind of guided you or influenced you in business? Which wanted to kind of ask, what are some ways, specific strategies that you have used to help, monetize, your degree as a doctor, your career as a doctor outside of seeing patients?
Yeah. So one of the first business that I actually built was a speaking business. So when I was in my intern year in general surgery, I started to see the writing on the wall really early, as far as like if I was going to practice in a traditional way, which is being an employee. I really started to notice, hey, I'm spending a lot of time at the hospital. I'm sacrificing a lot. I'm not able to see my daughter. I'm not able to see my fiance at the time. And I really started to question, why was I doing all this, and what was the impact I was going to have? Was it just going to be, me being successful and making all this money? What was going to be the impact of that? And so that's when I actually started saying, okay, God, well, how do you want me to use my gifts other than medicine? And I'm very passionate about encouraging young men, specifically young men of color. And I started a mentoring program. I was in San Antonio at the time, and I just started asking around, where's the worst neighborhood? Like, where's the worst place in here? And they're like, oh, you need to go to the east side. So I went to the east side and I started a mentoring program. Well, word kind of got out, and I said, hey, this doctor over here. And I kept getting asked to speak. I said, hey, I got a business. So I started putting packaging, my presentations together, offering workshops, keynotes, things like that. And then from there, that spun into creating products. So those are books, online courses, masterminds, group coaching. And so this is all me taking the lessons that I've learned in life and packaging it and offering it to someone as kind of like a fast track to get to where you want to go. And so, so mostly in the information product world or the expert industry are all the other businesses that I own are in self-help and kind of personal development. But it's really, and that's just been really me monetizing my story. So I don't really talk about any medical management topics, like how do you manage diabetes. I don't really speak on any of that. I speak on how do you take an idea in your mind, and just from that idea, materialize it. So just from an idea of a business, how do you go from that idea to actually sitting in Exhort Health's office? Yeah, how do you do that? How do you go from this idea of I have this book to actually holding it in your hand? How do you go from, hey, I want to start this speaking business to actually being out on tour speaking? So that's those are the businesses that I've kind of created, really just off of my passions, and offering them to the world, packaging them, but offering them. And it's in the offering. You're not going to get a yes with every offer,
Yeah,
but you're going to get a yes if you continue to offer.
that's powerful. And that's kind of want me to ask, I know you're a regular TV health expert, where, people ask for your opinions and things of that sort. But before I go into that specific question, I want to ask, how do you stay current with the latest trends and the advancement in the healthcare industry? I know there's a lot that you deal with, but how do you stay connected to everything that's going on?
And in our medicine world, there's this little thing called CME, continued medical education, that in many states is actually required to maintain your medical license. And so, that's kind of me looking at the offerings. What do I want to learn about? What's the newest thing? And just going and taking courses and learning. They call it the practice of medicine. We're always practicing. We're always perfecting kind of our craft. And so there's tons of medical education that is out there. And so for me, it's really just dialing in. What do I want to learn about? Where do I want to advance? Is there a new service I want Exhort Health to offer? Is there a new device that I feel like could add value to the patients? And kind of learning that way, but also just being involved with other owners that are in the healthcare space, talking to other doctors that own clinics, maybe urgent cares or private practice owners, and just kind of talking about, hey, what are some of the things that you're seeing? What are some of the opportunities you think are out there? Have you heard of anything new? So it's really just having your ear to the ground, but then also taking initiative to find places to continue to learn. But obviously I've medical school, business school. I like learning, that's just, I'm just wired that way. I like to learn. I like to read. And so those are some of the things I do to kind of keep up with the current trends.
That's pretty. And how did you, find your way to be, regularly on TV, talking to people about different health issues? And how has that been for you so far?
Just really being available and putting your name in the hat. The first TV spots that I got were actually, they came from a partnership with my business program, my business school program, my MBA program that I was a part of. I went to the leadership and said, hey, I'm writing this book. I think, if we partner with the university's PR to kind of, hey, talk about this success story of someone that's coming through your program, I think it could be a win-win. So really just seeing opportunity and also presenting that, and then putting your name in the hat. So through that, I was able to get pitched for different shows, different segments. And then as I continue to do more and more reps, your name kind of gets out there and you build relationships with some of the reporters. So then if they have a question, it could come to you. But also you're able to reach out to them with current stories, right? So it's like, hey, this new thing is going on in healthcare. I think this would be interesting for the public to learn about. So you're able to kind of, because you have those relationships, you're able to kind of pitch stories, if you will, in your space. So, for me, I think talking doctor to doctor can be, okay, like this person has these credentials. And when you talk doctor to doctor, it's very, very different. But for me, for a lay person, is what we call it, like the general public, I really do feel like doctors have a responsibility to educate. And I know, obviously, coming through the pandemic and all this craziness that happened, believe it or not, there was a time when, and there's still people that view that there was a time, there's some portions of the population that see my MD and that's like not credible because there's so much of medical doctors are trained to do surgery and treat with medications. There's a string of patients that are actually looking for non-MDs now
Yeah.
because they're not there's not the trust isn't there. So for me, doing segments and um, being a face in the public to answer questions is some of the highest work that I can do because I just remember during COVID, I had so many people, specifically in minority communities, reach out to me and ask questions because they just did not trust the providers they were seeing,
Yeah.
And so, but yeah, so it's maybe a simple question. Oh, why do you do TV segments? But for me, it really goes deeper than that. It's really a responsibility that I feel like we have, specifically in a minority community, to share good science and good information so that patients can make the best health choices for themselves.
No, that's very powerful, and I'm glad that you kind of mentioned credibility because that's something that's a very big issue, especially now in our age, especially through the pandemic, and people have a lot of different exposure, to different medicine, different ways of trying to keep themselves healthy. And I want to ask you, how do you position yourself where you stay credible on the things you say? Because sometimes science always changing, like I saw it firsthand with Dr. Fauci, how he was getting hammered from both the left and the right side. So I want to ask, how do you not keep that balance where you're not, going from one end to another end and you're losing trust today? So how do you keep that balance?
You know, I just think the most important thing is approaching the information that you share from a position of humility and understanding that you're learning as you go. And for me, if I'm going to make a recommendation or if I'm going to speak on something, or if I'm going to treat a patient with a medication or I'm going to do this treatment plan or make this recommendation, for me, I really treat the patients like they're my family. So if I'm not going to give it to my kid, I might make you mad by not giving it to yours, but I'm not going to give it to yours because this was my kid. I wouldn't give him the medication.
Mm,
Right. And so like that's how I practice because I want to be able to go to bed and go to sleep at night and know that, expect the next provider that may see my family member or someone in my that's close to me and give them the same treatment. Right. But for me, it's, hey, I don't know everything. I'm the type of doctor that will tell you I don't know. And I don't have a problem with it because if I don't know, I don't know. I'm not the type of doctor, oh, I know everything and I'm faultless and I could never make a mistake. No, for me, it's just approaching it from, hey, I'm a scientist, I'm learning, I'm a physician, I'm practicing. Here's what I think is best. But then also, hey, if you treat and it doesn't work, also being there and available to, okay, let's try something else, let's try something different. Okay, that didn't work, right? And taking that, if you do make a mistake, apologizing, right? Like all these things matter. I feel like people don't expect you to be um, perfect, but you do need, when you do mess up or you do have a mistake, you need to speak to it and apologize. And that's the way you can keep your integrity, right? You can keep your integrity as a person. Nobody's going to expect you not to make any mistakes. But for me, I always kind of present the information from a kind of a humble, a student, an educator kind of role. And this is what we're seeing right now. And knowing that things may change, there may be new developments. But with the
yeah.
information I have right now, here's going to be my recommendations. But that's basically how I approach it.
That's pretty dope. And I want to ask, because you wear a lot of hats just from this interview, but how do you, take care of yourself personally on a personal level? You know, your father, your husband, how do you make sure that you're good and able to continue to go? Like, what does your daily schedule look like? If you
That's
can
it. That's
share.
a Yeah, that's a great question. I think the times where, and I've learned this from the times where I have actually quit doing the things that kept me filled. And so, for me, being able to have some time to myself, I specifically take time in the mornings before my uh, before my house is up. So I've got 5 kids, so we get up early. So I'm up at 4:30, spending time with God. I like to read the Bible. I like to work out, just move. It could be me running, it could be me lifting weights, doing push-ups, jumping jacks, something, just getting my heart rate up. I love to move. And then also having some quiet time to think, because I do a lot of things. I'm really busy. Once I get to the office, it'll be phone call, email, patient, podcast, like it's boom, 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 it's a go, go, go. So I really have to be intentional with having quiet time and being able to think. But for me, I get most of that done in the morning. And then also I practice the Sabbath. So I take Sundays off. I just take them off, and if I can take a day, completely reset, say I'm not doing any work, I have found that that's been the best way for me to come back, revitalize, and kind of rejuvenate it when I'm back in the office. The times in my life where, and I also put on that, I won't say I'm completely strict with my diet, but I'm pretty intentional with what I put in my body, what I eat, what I don't eat, hydration, you know. But the times where I had to learn all this the hard way. So there are times in my life where, like I don't drink alcohol, but there's times in my life where I've drank alcohol, and alcohol it didn't add a bunch of value to me. Like, it actually made me feel worse. There's been times where I would use energy drinks. I was like, oh, I need an energy drink. It's going to help me out. Oh, it made me feel worse. There's been times where I wasn't really strict about my diet. I just ate kind of everything. Oh, I'm eating, I work out, I can come. It made me feel worse. There's been times where I did not practice a Sabbath and I worked 7 days a week for months on end, and I started to feel burnout. It didn't work. So for me, and not to say I'm perfect or I have this, I know exactly everything, really was from trial and error and realizing what are the things that fuel me up, what are the things that help me feel the best. And if I can do those things consistently each day, I can show up my best self, right? So if I'm spending my time in my word, if I'm getting my exercise, if I'm meditating, I got my quiet time, then I can show up my best self. If I take those things out, then I can't show up the best me.
Oh, that is very true. And I want to kind of circle back. Like you mentioned that, when you started speaking, you started mentoring people, specifically male, black male. But my question is, specifically for young Christians who are going into medical field or are currently in the medical field, how would you advise them to align their career goals with their faith and value?
I will say this: you don't have to leave your faith outside of that patient exam room. I I pray with my patients. Like, I have a faith. I take it with me. It's an advantage, and you will actually draw. God will send people to you because they resonate with that. I do business with, part of our practice is occupational medicine. So I go out and I offer businesses health services, and people will resonate with your faith if you lead with it. But many times, depending on where you're at, you might feel like, oh, people are going to think I'm too Christianese, and I got the Bible, I'm gonna be hitting them across the head with it, and but for me, I've just decided I'm going to take it with me everywhere that I go. So Exhort Health's mission is to glorify God, right? We're an extension of the healing ministry of Jesus Christ. And so I that's the foundation I started the organization with. So I would just encourage Christians that are going into healthcare is just to know, you can take your faith with you. Right, take your faith with you. Pray over your patients. Pray over the procedures. Bring God in everything that you do. It doesn't have to be this separation of science and faith. This past weekend we just had an event here at Exhort Health where we just opened up the clinic for whoever in the community wanted to come and get care. And so it went from seeing a nurse practitioner, seeing the doctor, to going to the prayer room, and we're praying and prophesying over people and rebuking Satan over people, right? All in the same place. So it's like, so I would just encourage our Christians that are in healthcare. It's my belief that Christ's standard is the highest. So if you practice healthcare underneath Jesus's principles, you will always shine.
Oh, that's very powerful. I know a lot of people who are, medical doctors, nurse, and they shy away from speaking about their faith in the medical field because they're trying to keep that balance from science and faith. So I definitely appreciate you sharing that word of advice. To wrap up this interview, I want to, I know you mentioned that you see the healthcare industry, going towards more of the doctor ownership. But is there anything else, any different patterns or anything you see that people should be aware of in the near future?
Now, I would just encourage patients to apply pressure to the insurance companies. Apply pressure meaning make them add value to you on a monthly and daily basis. Understand the products that you're buying from them, and don't just have the insurance company check a box, say I have health insurance. How are they actually encouraging your health? How are they improving your health? So that would be my biggest thing. I think just empowering patients to know, hey, you have choices. You don't have to be in all these little boxes. I think the most important thing is just empowering the patients to take control of their health care. And, yes, we know we have to have health insurance, but, who you choose and what products you purchase, just make sure you're fully educated on that. And the reason I go on that is because many times this is what I have seen in my praxis. This is what ends up being a barrier to care. And so I think the more educated patients are, the more empowered they become, the better decisions they can make, right? And then they can feel more in control of their health care. So that's what I would just encourage. Look into that agreement, look into that product that you purchased, and making sure you're utilizing it for your benefit.
Is there any resource that you can direct people who are patients that can to understand the kind of health insurance and health product? Because, like when I go to the
Good.
doctor, to be honest with you, I don't know exactly what is my
Yeah.
health. It's just like I just go see the doctor and yeah.
I always tell folks, Mr. and Mrs. Googs, okay? Google. Don't accept little acronyms and things that you don't understand. Start first with Google to try to see if you can get a good understanding of the components of your product. And then if you don't understand, call them and make them explain it to you. Ask them over the phone. I mean, they have most insurance companies will have kind of customer service or customer support that's their job, is to actually answer your questions. But many patients don't call and don't ask the question. They just kind of say, oh, that's just the way it is, or my insurance company's not going to pay for this, or they didn't pay for that. Call them and find out why.
Yeah, I think it also kind of do with fear, the fear of the unknown, like you mentioned, you don't know those acronym means or what it could result to if you start asking questions. So I think that's the reason why a lot of people don't ask questions. 'Cause I have a lot of friends, they haven't been to the doctor since who knows when, because they don't know what kind of questions to ask. And one thing that came to mind, because I know you talk about your company wants to disrupt this current industry, but how do you feel about technology and how it's changing and it's helping, this industry help and service more people? Like, do you see any changes or any pros and cons do you see? Like, do you see any pros and cons with this advancement of technology in the healthcare system?
No, I love it. I think artificial intelligence is definitely going to take off in healthcare. It's already kind of creeping in. I just think the amount of data that a physician or healthcare provider is really required to process to make the best decisions. I think it's just becoming more and more. There's just more and more tests. It's just more and more data that's being piled on, and I think with artificial intelligence that could help facilitate better decision making. Obviously, it's things won't go on autopilot. It's still a practice of care. You're still going to need someone. But I love tech. I love the technology. I love the virtual different components that people have and using technology. I love it. I absolutely love it, and I think it needs to be welcomed in our healthcare space. But understanding that if you're starting a healthcare tech healthcare, I would just encourage the people that are going into that space to innovate. Just make sure you got doctors and nurses and MAs, in product people actually, helping you make that product and make it the best. Because you will see you are beginning to see a disconnect between the tech and the providers, and there's this clashing of, oh, are they trying to replace me? Is a robot going to replace a doctor and all this stuff? I'm more of the persuasion that no, let's be on the team together. Have the doctors help you develop the AI. Have the doctors be over your shoulder helping you to produce the use technology in the most advantageous way. But I'm a huge proponent of technology in healthcare, and I think it's an intelligence that we have, and we definitely need to be using it more.
No, that was pretty great. Just like reflecting back as we run this interview, I'm starting to see and understand better why it's important for doctors to be involved in these different business decisions, and just like inventions, because I can see how there can be a situation where you create a new product, whether it's an MRI scan or whatever it may be, and you tell a doctor to use it, and that's small things that the doctor needs to learn how to use, and they're not getting any kind of compensation, so they will get frustrated, and it will lead to all these different other issues that we have spoken about in this interview. And I want to give you the opportunity now for those who may be listening, because I do have a lot of Caribbean people, African, it's like being a doctor, nurses, and all these different things are big careers that they value in these communities. Is there any opportunities or ways for people can connect with you? You can talk about the different mentorships you have as well.
Yeah, the website is probably the best place. So clarenceleejr.com. If you want to learn more about Exhort Health, just exhorthealth.com. And then I'm on all the social media platforms, the TikToks, the Instagrams, all at Dr. Clarence Lee Jr. But yeah, for me, any opportunity that I have to encourage someone to seed into their dream, to kind of help encourage them in their faith and in their walk, that's what I'm about. That's what I feel like I'm on this earth to do. So I encourage people to reach out. I answer questions. I hit people back in the DMs all the time. I've got virtual assistants that help me keep things going. So reach out if there's some value you feel like I could bring. But I hold that in high priority. If somebody's reaching out, I try to get back to people best I can.
That's great. And where do you see yourself and your business as Exhort Health in the next 10, 20 years from now?
Yeah, the 10, 20-year plan is to really have hospitals. Okay, so I'm looking to drop into a community, a healthcare desert, if you will, build up subspecialty practices, and then build a hospital. And so work with the local employers to have Exhort Health as a benefit, and to have our privatized health system. So, my goal right now of the next 10 years is to continue to acquire assets, that may imaging centers, surgery centers, various subspecialty practices, to come under the umbrella of Exhort Health. So once we have everything and we can offer everything to the patient, then open a hospital. So that's the big vision for Exhort Health. We're really looking to kind of change things, and and not shy away from our faith, to have a place where people can come and not only get taken care of, but to also get prayed for, and really become a place that encourages health and healing. But that's the big vision, brother. That's the big vision.
Wow. I definitely want to say thank you, Dr. Lee, for your time. And for those who are listening, I hope you guys don't see as another entrepreneur, another guest on the show, sharing their stories, sharing their mission. I hope this encourages you. I hope this, inspire you to do better, to tap into what God has called you. And if you're looking for a group of Christians who are working towards becoming financially free, look no further than join the Pray and Invest group on Facebook. And I just have one more question for you, Dr. Lee. If you can give a word of advice for someone who may be in the medical field, who may be struggling, who may be feeling overwhelmed, burnout, what would you tell that person?
So I actually this weekend, we like I said, we had a big event. We opened up Exhort Health, and I felt like I got a word from God that our healers need healing. And so I would say the beginning of it is understanding that we have this calling to be healers, but at the same time we need to be healed ourselves. And so in order to be healed, we need to open ourselves up and accept that as a possibility for ourselves. So I would just encourage folks, filling your cup, doing the things that fill you up is not selfish. It's actually the best thing that you can do for yourself and everyone else. Because if you're pouring out, there's nothing else to give, then you don't have anything else to give. But if you're making sure that you're filling up, making sure you're taking care of yourself, putting your oxygen mask on first, as they say, and then helping others, I feel like that's how we will see transformation in kind of the workplace environment. But as long as it's, hey, you skipping meals, you staying up all night, you're not sleeping, you're not taking care of yourself, that's just going to lead to burnout. So I'll just say, healers need to heal as well. I feel like our community needs to come around and understand that, yes, healthcare professionals, we are called to heal. We're called to help, but at the same time, we need to be able to focus on ourselves and have time to focus on ourselves so that we can heal, so that we can be better healers for others.
Wow, that's very powerful. And thank you very much, Dr. Clarence Lee. And for those who are listening, if you have yet to subscribe to us on YouTube, please hit the subscribe button and stay tuned for next week's episode. Thank you again, Dr. Clarence Lee.
Absolutely, bro.